So morning, I'm sitting here in Amsterdam at the World EPA Conference together with Yvette Venable, who is Global Director of Payer Partnerships and Policy at AstraZeneca. And with her, I like to cover 3 topics if we get to it, but at least the first one I want to cover is the patient experience dossiers. Hopefully we touch a bit on value-based pricing and value recognition as well. But maybe, Yvette, quickly introduce yourself, like who you are, what's your role, and what. I told your title, but what is it you're exactly doing at AstraZeneca?
So it's a really unique role within our market access group in AstraZeneca for our biopharmaceutical business unit, which covers cardio-renal metabolic, respiratory and immunology, and vaccines as well.
Everything
under the sun,
oncology.
Very diverse, but a lot of chronic conditions, a lot of themes of prevention, both primary and secondary. So a very interesting area when we think about market access and value recognition. So my background, although I'm at AstraZeneca now, I have a very broad background in health policy and patient advocacy and market access. So I've been doing this for over 25 years.
Wow.
And I actually started as a journalist and found my way to do motorsports PR, and through that got into healthcare.
Okay, but that's a whole separate story.
That's a whole other story.
Oh, that's cool.
But in addition to that, I also have a master's in public health from Imperial in London, and so I do have a strong scientific background as well.
That's cool. Yeah, and I was really impressed. I think we spoke a few weeks ago, and then you came up with the concept of the patient experience dossiers, and that really triggered me. So can you explain a bit more? Because I think it's a really powerful concept.
So I would love to take credit for inventing this, but I did not. But I was a part of the original group that kind of led to its creation. So the idea behind patient experience dossier came out of some work that I did when I was the first vice president of patient engagement at ICER, which is the U.S. think tank that acts as a HTA for the U.S. And I worked very closely with the U.S. umbrella patient organization called the National Health Council, and we talked a lot about how do we really improve patient data within value assessment. And we were looking specifically at the U.S. context, but of course I had a lot of experience outside the U.S. as well. And I really saw the potential because that conversation about patient voice in HTA has really shifted from being one of a very emotional testimony
more
to being
personal
much
and
more evidence informed, right?
Yeah.
And in order to do that, we knew that there was a lot of patient experience data that had been generated by all different kinds of sources, some academic, some industry, some patient organizations themselves, but there was no real easy way to consolidate that or curate it in a way that it was useful in an HTA process, which is already a very difficult thing for most patient groups to be involved in just because it's a lot of work, right?
Yeah.
So the idea of the patient experience dossier was born as an idea to create a standardized template across 5 different dimensions of patient experience, and to understand what data exist, where are the gaps, both to inform future evidence generation, but also to use that in all different kinds of health decision making. So while we were thinking of it originally from the HTA and value assessment perspective, we've also found that the regulators are very interested in this as well.
Okay. So both FDA and EMA is...
Yes,
Okay.
So the template was finally created through a multi-stakeholder working group that was funded by pharma and the National Pharmaceutical Council in the U.S. So there was industry involvement there as well. But the 5 domains are sort of the topic. First topic is around the patient journey itself, which is very important, and we all need to understand that as we're thinking about what needs we are trying to address with new agents. The second one is the burden of disease and impacts of daily life. So I think this oftentimes goes beyond just what we're doing from a health economics perspective in terms of burden of disease, but really understanding what's important to patients and their own kind of wish lists of their outcomes and what they want to see.
Yeah, it's more related to personal life, things you can...
Exactly. Like for some immunology conditions, is this treatment going to allow me to come off this really toxic treatment that then allows me to have children, pursue a family, these kinds of things, right?
Yeah.
So the third one is just patient perspectives on current and future treatments, and this is where we find oftentimes a lot of lack of data. So that's one piece. And then the last one is just more generally, or kind of a catch-all, just more broadly, what are the needs for the patients right now? Where do they really see that?
I like it because to a certain extent, don't get me wrong, but it's very specific, but it's also broad enough to capture different diseases, because
Absolutely.
the risk I would see is you standardize and you don't acknowledge that patients can have different diseases, to your point.
Absolutely. So the intent of these dossiers is to really partner with patient communities, and in some cases it's been patient communities that have taken the lead on generating this. So we've seen this in some of the cardiology groups who are really advanced in trying to create these for different conditions.
Are you aware if there are already any regulatory or HTA decisions where this has been taken into account? Or?
Not yet. It's still in its infancy.
No problem.
So we hope to see that. What you are seeing just generally is a lot of regulatory guidance now. EMA just has come out with a consultation paper on patient experience data. They explicitly acknowledge the use of data not only for regulatory purposes, but also for HTA. And I think as the JCA here in Europe gets stronger, this is going to be a prime opportunity to share this kind of data.
So I can imagine you already shared the concept or discussed it a lot with all patient organizations in Europe. Very good.
Exactly.
Okay. There's one other topic which is quite related that I still want to discuss. You also already mentioned value. No, and I think here's also on the conference, it's value recognition is the big buzzword, like especially Europe, we need to recognize value better. But I think you mentioned when we talked before, value is a very broad concept. How can we make it more specific in your mind?
I think it starts with actually having that understanding from the patients themselves, right?
Yeah.
We don't always think of doing patient engagement specifically for, thinking about our evidence generation for HTA, and our health economics and our market access strategy planning. But I think that's a very, very important thing. And it's not just so that patient advocates can go and advocate for new treatments. It's because we actually want to make sure that our value as we are defining it is defined in terms of what is important to patients.
Yeah.
And so we need to understand that at quite a granular level. Because again, if we take the example of a young woman with a condition that requires, some pretty toxic drugs in order to, keep an immune response down, that's going to, mean she maybe can't pursue having a family like she wants. And that could be very important. So if you have a new drug that's then not going to have those toxic side effects and also not rely on having that older treatment in the mix, then that becomes a much more meaningful value to that patient than just maybe what our scientific data says. So how do we contextualize that, and how do we document that in a way that is usable in the context of value assessment?
And I think you made a very good point as well. I remember what you also just said, that it's the risk is we can define it from a patient perspective, like you said, but I think for it to be recognized, we also need to generate the proper data to substantiate that value, because otherwise, in my mind at least, that value story becomes quite empty, because we say there's a lot of value for patients, but I think it's up to the industry to also demonstrate it then to the different stakeholders.
And I'm really pleased because I've seen a lot of our health economics team really looking at that kind of work and incorporating that in their own strategic planning around their evidence plans. And I think that's a really great step forward.
I just realized that might be a big mindset shift for them, to be honest, and not to disqualify people, but I can imagine they're used more to work in the clinical domain, clinical value, and then shifting more to patient elements of value. That might be a bit new and unusual, but it's great to hear them embracing it. It's
I think the willingness is very much there. I mean, change is always difficult to for sure. But I think I see it in the mindset of a lot of the health economists that I work with at AstraZeneca. So I know that they're doing their best to try and really incorporate that perspective in their work.
Very cool. Thanks a lot, Yvette. It was really great and always very inspiring to hear how you're driving the patient voice inside the companies, but also outside. So thanks for doing that on behalf, I think, of a lot of all patients here in Europe. So
thank you. I really appreciate the opportunity, Casper.
Likewise.